Hello nurses, I am RN Kamaljeet from Nursing Exam Prep. In this video, we will discuss the topic how to become a nurse in Canada. This is the mostly searched topic on the YouTube and on the internet because the international nurses who are planning to come to Canada, they want to get information like how to become a nurse in Canada. So, nurses, if you are planning to come to Canada as a study permit, as a work permit, or as a permanent residency, so this video is especially for you. So, I hope so you will get the idea how to become a nurse in Canada before you land in the Canada. So, let's start the topic. So, the first process or first step to become a nurse in Canada is that you submit your application to get eligibility to write NCLEX RN or XPN because there are two type of nurses in Canada, like RN, or the second one is RPN or LPN. We can say that RN is a registered nurse, or RPN or LPN. They both are same. It's only the province wise. In some provinces they call it LPN, licensed practical nurse, or in some provinces they call it RPN, that is registered practical nurse. So first you will submit your application to get the eligibility to write the NCLEX exam or XPN, we can say. Then you pass that exam, and then you meet the other requirements that we will discuss later on. And once you meet all the requirements, then you will get your nursing registration, that we call the nursing license, and then you can start working as a nurse. See, that's a good thing. So now we will discuss each step in detail. So the first thing, how you will get your eligibility to write the NCLEX or an exam. So you can either start your application with NNAS. So actually, NNAS was the very popular, we can say that organization who give eligibility to the international nurses. It's National Nursing Assessment Service. Actually, it cover most of the provinces of the Canada except Quebec. And but nowadays, because the other regulatory bodies are also popular to give NCLEX eligibility, and their process is really very fast. So second is New York State Education Department. So it's in a US. So you can also apply in the New York State Board to get the eligibility for an RN exam. And once you pass your exam, then you can transfer your license to the Canadian province or the Canadian regulatory body. So next is Australian Health Practitioner Regulation Agency. So this organization also started giving eligibility for Canadian nurses. Means like you can get their eligibility, you can pass the NCLEX RN exam, and then you can transfer your license, or you can send your detail of your examination result to the Canadian regulatory body, and they will accept it and they can issue you the nursing license after the completion of all the rest of the requirements. So NNAS, NYSED, and EFRA, these were the other regulatory bodies. But next is CARNA. So it's only the province wise, because NNAS, it covers most of the provinces of the Canada, and New York board, it's from the USA, but you can transfer your license to the Canadian provinces. And then EFRA is the Australian Health Practitioner Regulation Body. So next is CARNA, that's College of Registered Nurses of Alberta. It is only related to Alberta state. You can apply your application to CARNA. You can get the eligibility to write the NCLEX or an exam. And then if you want to transfer your license, like for example to Ontario or to the rest of the provinces, then you can transfer that, or either you can start working in Alberta healthcare settings. The next is OIIQ. Actually, people are not really aware about OIIQ, too, because not most of the people discuss this option. This is also option to become a nurse in Canada, RPN or RN, but this is only in the Quebec, because Quebec does not accept the NNS or any other assessment. They only accept the assessment from the OIQ. It's in French. I will try to um, pronounce it. It's Ordre des Infirmiers et Infirmières du Quebec. Maybe it will be wrong, but I just tried. So you can apply your application to OIQ. You can get the eligibility if you meet all the standards according to the OIQ. And then here you can write down the OIQ exam. And then you can um, get your nursing license after the completion of the rest of the requirements. So next, first we will discuss the step of the NNS. So like if you want to apply through NNS, so it's a simple process, but it takes few months to process your application. You will create your account on NNS. You will fill your personal information. You will fill your nursing education, like your college and education. When you start the college, when you finish the college, the name of the college and everything. Then you will fill your nursing registration information, the RN that we get from our regulatory body, or you can say the registration council. And then you will fill your nursing experience, if applicable, if you have any nursing experience. Then you will submit your application and pay the fees. Then you download the forms and send these forms for verification. You send your forms to your college, to your registration board, and to your employer if required. So this was all about the NNAS. You can also choose this pathway to get the NCLEX RN eligibility, or to get the RPN eligibility also. So the next board is AFRA, the Australian Health Practitioner Regulation. So in this step is same, that you create your account, you fill your personal information, you fill your nursing education, you fill your nursing registration information, and if you have any other nursing experience, if applicable, and you submit your documents like copy of the academic transcripts, and you submit the other documents like proof of identity, employment record if applicable, and evidence if any name change, because it's common that like if you get married, so maybe your surname is now with your name, but on your education document maybe you don't have your surname. So you need to submit the proof that your name has been changed, and then you submit your application and pay the fees. So once you get your eligibility from AFRA to write the NCLEX RN exam, then you can pass the exam, and then you can transfer your license from Australia to Canada. You will open your file with any Canada province. For example, you will open your application like with the CNO, the College of Nurses of Ontario, and then you can submit your result from the Australian body to the CNO, and they will accept it. And after the completion of rest of the requirements, they will issue you the nursing registration, and then you can start working as a nurse in Canada through the AFRA process. So next process is New York State Education Department. So application process is almost same, because it cover the four main point, like your personal information, your education, your registration, and proof of identity, and your employment history if you have any work record. So in this application, you will create the account, you will fill the application, you will get your credential verified, like from the college of registration council. Like if I give the example in Punjab, so it's a PNRC, Punjab Nursing Registration Council, and like you can fill the information whatever the regulatory body you have in your back home, or whatever the regulatory that your college was connected, right? So next you submit your identity proof that is required. right? And like passport, driving license, PR card, healthcare card. Actually, they mention like when you fill the application, you can see that whatever they are asking for. Then you will submit your application, and if you have after the thorough verification, so they check the authentication verification, and they check everything, like if there is anything wrong with the document. So after the thorough verification, they give you eligibility to write the NCLEX RN exam. So once you pass your examination, so it's the same process. You can open your file with any Canadian province regulatory body, uh, like for example the CNO, College of Nurses of Ontario, and you can submit your result from the New York board to the CNO. So then CNO will do the thorough verification. If everything is okay, then they will meet your requirement for examination and nursing education. So like you just need to fulfill the other requirements, and then you are ready to get your registration. So next is application for Karna, that is College of Registration Nurses of Alberta, Registered Nurses of Alberta. So it's the same process. You will create your account, fill nursing education, and fill your personal information, your nursing registration experience, submit your identity proof, and submit application and pay your fees. And but like in the applications, like there are some few steps that I will mention later on, like to do the Euripidence exam. Like even in the Karna, there is a patient protection, like kind of short course that you need to complete it before you declare your application. And so there are few steps that when you will submit your application, then you can see it in detail. So here I am just mentioning the main step, right? So once you will start your application, you will come to know that what are the rest of the requirements. So like for example, like with any of the like we can say that the regulation board, like either it's a NNAS or EFRA or Karna or New York State Board or OIQ. So for example, if you get the eligibility, so what is the next, right? Because some people said that okay, now we received our eligibility, so now what are we supposed to do, right? So then you will book your exam with Pearson View, right? It's a board that like we can say that it's a board that conducts the examination, and you prepare well for exam. So this is the main step, right? I should write down only first. So then prepare for examination and pass the test and fulfill the other requirements. So what are the other requirements? Even if you passed your examination, so people said like, oh, this was the main step, right? We passed examination, but still we have other requirements. Yes, you have to fulfill other requirements to work as a Canadian nurse. So what are the other requirements? But here I would like to give you the disclaimer that like these requirements are depend on the province, right? Because in the every province they have a different regulatory body and they have a different requirement. But I am covering the that is the most common requirements in every province. Language proficiency, you have to show them that you have a language skills that you can work in Canadian healthcare setting, means you have a good knowledge of English speaking, reading, writing, and listening, that you can check on your like on the like to whom you are going to apply. You can check on their website like what are the options to fulfill this language proficiency requirement. So next is jurisprudence exam. So this exam is related to the ethics. So we can say that ethics, patient protection and safety, and some law and regulation in the nursing profession. So you have to pass this examination before you get your nursing license. If you, like without the passing of this examination or this requirement, you cannot reach to the final step to get the nursing license. So you also need to give them the proof of authorization to work. Means like you have to submit your work permit. Like if you are on study permit, like you can, I think, I'm not sure if you like you can do 20 hours, like, but I'm not sure if you can still do the more hours. So like if you are on student study permit, then you have to submit your study permit. And if you're on work permit, submit your work permit. And if you are on permanent residency or you are citizen already, then you need to submit your proof that. So they will meet your requirements to authorization to work. And post clearance, so they check your record if anything wrong in your past, or if there is any like charges on you. So you have to fulfill this requirement also. And evidence of practice, so your evidence of practice, it's also depend on the province wise. Like if I give an example for CNO, like if you did not work in the last 3 years, so they will give you like to do 400 hours or few courses to meet that gap. So this is also the requirement. Like without fulfilling these requirements, like you cannot come to the final step, that is to get the nursing registration. If I tell you my personal experience, like I passed my examination like in 2020, but because of these rest of the requirements, I get my license little late. So like even if you passed your NCLEX or an exam, so without fulfilling these requirements, you cannot get your nursing registration. So the last step is that when all the requirements are met, you will get your registration province wise, like from your province, and then you can start working as a nurse in Canada. So the last step is to start working as RN. That's the good one. So this was all about the process to become a nurse in Canada. I hope this video will be helpful for you, and it will help you if you are planning to move to Canada. And this will help you to get a guidance to become a RN or RPN in Canada. So please share this video with your friends and your families, and who is preparing to become a nurse in Canada, and who is planning to come to Canada, and who is international nurses here and need some guidance about the process to become nurse in Canada. So please subscribe my channel and press the bell icon to get notification. I will make videos related to NCLEX, related to nursing. That will be very helpful for the international nurses, and you will get guidance to become nurses in Canada. And I also post some important topics regarding the NCLEX exam. So now I will see you in the next video. Thank you so much.